Dear patients, you people know I usually bring you premium gist that happens in the hospital. So today, 17th of September 2025, some couples came to the hospital, the general department, for premarital screening. So I don't know, probably one of the practitioners there encouraged them to include vision screening. You know, some of you don't know that premarital screening now does not only involve check whether you people are compatible, check all this other fertility and rest of them. It now involves you having your eyes screened for some vision disorders that can also make two of you not to be compatible. I'm going to make a video on that soon. But for now, let me tell you people what happened. So these people have walked into the eye department, and then I saw them with envelope, maybe result from the previous premarital screening they had done or whatever. So after they told me they came for vision screening, I said, no problem. I told the man to sit outside, let me attend to the wife first. Then after he will come inside. Or would you too want to stay in the consulting room? The husband said, no problem, let him go and stay outside. And in a normal ground or in a sane environment, whatever I'm discussing with the wife, I'm not supposed to discuss with the husband unless both of them give me permission to. So when the man accepted to sit outside, I attended to the wife. After I finished attending to the wife, I told the wife to excuse us while I attend to the husband. That's the husband to be, sorry, the fiance, because what they came for is premarital screening. So I finished attending to the husband, and I found out that the husband is, will I even call, a glaucoma patient. Yes, I've made several videos about glaucoma. If you have been watching me, if you are following me, you should be familiar with what glaucoma is and how dangerous it is. So I told the man that there is something we look out for in the eyes. For eye doctors who will be watching this video, you understand what I'm trying to say. Now, we call it the cupping in the eyes. Now, normal, if we are looking at the normal cupping of in the eyes, is usually from 0.2 to 0.4. Some patients, especially patients that are myopic patients, can have up to 0.5 due to myopic crescent and the rest of them. So sometimes we don't actually categorize them as people that are glaucoma patients because they usually have large cupping. So this thing, this cupping I'm talking about, is just a sign that an eye doctor sees and starts suspecting a patient to be a glaucoma patient. So I saw this man's own to be 0.75, almost 0.8, and that is very risky. So when I saw it, I said, okay, let me confirm by checking the eye pressure and check whether the eye pressure is normal and all that. Because this is a patient I'm seeing for the first time, so I don't know whether it's how he was born or whatever. I don't know. Is some eye doctors that would be watching this video that will understand what I'm trying to say. So I subjected this man. I told him, let me check. We are going to check your eye pressure. You're going to pay for this test. It's also amount. The man said, okay. I checked the eye pressure. On the right eye, I was having 47 millimeter mercury, and on the left eye, I was having 41 millimeter mercury. That is a huge difference. And the normal eye pressure is 10 millimeter mercury to 21 millimeter mercury. Now this man's own is very high. I asked him, you've not been happy? He said he used to experience blurry vision, but sometimes it will clear. He didn't take it serious and no. I said, okay, this is what is happening. No, I don't know if you want me to involve your wife to be, or you would want me to just keep it. Maybe you'll be the one to discuss with your wife to be. He said, no, he will know how to talk to his wife about it. So what is the solution? I told him, this is it, to have to place you on medication. And since I've seen that your eye pressure is too high, maybe the best option now is for you to go for surgery so that we can open up the channel through which the fluid in your eyes flow out, which is the major cause of increased eye pressure. So I finished counseling him. I gave him his own result in an envelope, and him and his wife, they left. Now, this is the major thing that is bothering me about this whole thing. When I was discussing it with my colleagues asked me a question. If that lady were to be my blood sister, either my junior sister or my senior sister, that's getting married to this man, that would I have told my sister? This question was a big blow on my face. Because for those of you that are into health practitioner, you know that You have no right to discuss a patient's health condition to even the relative unless they give you permission to. No matter how close they are to you, you have no right to do that. That patient can sue you for that. And then I asked myself, that's true. If this lady is to be my sister, will I tell my sister, say, this man where you won't marry is likely to lose his vision in future? Or will I keep it to myself? Because this is now between my profession and my sister. You won't want to hear the answer I am coming up with in my head. You won't even want to hear what I told my colleague. My colleague don't laugh tire. But I just said, let me tell you people this, and to also remind you that for those of you that intended to marry this coming December festive period, please remember to go for eye screening. It's very important. Don't just do fertility, don't just do blood group, don't just do genotype, don't just do sperm motility. Check your eyes.